So at the end of part one, we looked at this patient who, let's say we've just admitted to the hospital and he's going to be going home in a few days, and we need to think about what vulnerabilities does this patient have. Well, clearly there's a problem with language, which will make it difficult for him to express his needs and express a good history, and also make it difficult for him to understand the instructions that we give. Similarly, he has the problems with educational level, which is not optimal. Didn't complete high school, so again he may have difficulty understanding our instructions. He may not understand the importance of following through with certain things, etc. Furthermore, he lives alone, does not have any family nearby, so there's nobody to remind him about things, nobody to encourage him to take care of himself. Financially, there are problems. His income is low because he only has Social Security. Health insurance wise, he's on Medicare, which is what you would expect at this age. However, he has not signed up for the prescription coverage part of Medicare. Medicare Part D is the component of Medicare that was added within the last few years, which is intended to provide prescription coverage, which previously was lacking. He has not signed up for that, so he doesn't have it. Furthermore, he does not have a car because he couldn't afford to keep it, so that's going to be a problem. So these things are pretty obvious, I think. Here's a mnemonic that can help you to think about what kind of issues to look for when you're worried about a patient being vulnerable to errors and non-compliance. And you can see it covers the issues many of the issues that we talked about with that patient, and some additional ones. When you do your patient safety project, which you're going to do during the inpatient block, I'm going to ask you to think about each of these issues with regard to your patient and to tell me a little bit about each of these things. But more of that later. So now we know what it is about this patient that makes him or her vulnerable to errors. Let's think about what is it that we're going to ask the patient to do. What are the patient's instructions? Well, here's some discharge instructions for this patient. Again, I want you to pause for a moment and think about what it is about this regimen that the patient might have difficulty with. Okay, so clearly, if we think about medications first, the Coumadin is a complex regimen. It alternates different doses on different days. This is going to be hard for anybody to follow, but especially somebody with language problems. I would mention that Coumadin itself is a high-risk medication. If a person is non-compliant with Coumadin, for example, takes too much or too little or doesn't take any, then the consequences could be severe, such as bleeding or further thromboembolic events. So Coumadin in itself is a complicated medication. In this case, it also has a complex regimen. The other medications also are complex to follow because some of them are once a day, some of them are twice a day, and some are 3 times a day. So this is a difficult thing to be compliant with. So we shouldn't be surprised here if the patient is non-compliant. Secondly, there's problems with follow-up here. He has frequent follow-up required. INR, he has to go fairly frequently until it gets stabilized, and then maybe he can space it out to once a month. But there's going to be challenge involved in him getting to get the INR checked because he doesn't have a car. And he also has to see the PMD soon. So these are some obvious things that would be difficult for the patient to follow on. Let's think about some categories of things that we can use to help us to figure out for any given patient what are the red flags, if you like. Here are some categories. High-risk medications is one, and we talked about Coumadin as an example of that, and there are other examples listed here. Then there's the fact that the regimen may be complicated, which again was the case with our patient. That should be a red flag. Sometimes we ask patients to do complex investigations which require certain instructions to be followed carefully, otherwise the test is useless. A good example of that is a colonoscopy. If the patient doesn't take the prep correctly, then it's going to be hard to see anything. So we need to think about how feasible is it for the patient to actually take the prep. If the patient is in a wheelchair, for example, how is the patient going to get to the bathroom 10 times after taking the prep. That's probably not going to happen. So maybe we need to admit the patient into the hospital. So we need to think about what's feasible for the patient. Follow-up is another problem that often is faced by patients. We send them somewhere where perhaps they haven't been before. We have to just consider the question of, are they going to be able to get there? And we also need to consider the issue of when they get there, is the information that the cardiologist, for example, needs, is the information going to be there? Which is a more difficult issue and perhaps beyond the scope of this discussion. Monitoring is also important. Patients on certain medications may require frequent monitoring, and that Dilantin is a good example of that. Coumadin is another example. So now we're ready to do our patient safety project. How to complete the project? Well, as I alluded to before, you're going to find a patient who has some vulnerabilities, and you're going to use that access mnemonic to tell me what are the patient's vulnerabilities, such as, for example, patient's financial situation is difficult, or their insurance is inadequate, or they have difficulty with language or hearing or any of those kinds of things. It's important to find a patient who has some vulnerabilities, because if you choose a patient who has none of those problems, it's going to be very hard to score well on this project. Once you found a patient and you describe the vulnerabilities, you're going to enter them into UB Mobile Med. And the way that works is that there are different diagnosis categories within the UB Mobile Med system, and they have the title Patient Safety. You'll find them hopefully easily, and within those categories you'll find specific diagnoses which you can use to tell me, for example, that the patient has a telephone or doesn't have a telephone, or has Medicaid as their insurance, or has a commercial insurance, or whatever the case may be. Next, you're going to think about the process vulnerabilities, which is what we just finished talking about on the previous slide. Those things like high-risk medications or a complex medication regimen. And then the third part is to put those two pieces together and say, okay, because the patient has a poor financial situation, and because the patient has lots of medications to take, there's a risk that the patient may not be able to afford those medications. Or because the patient doesn't have a car and we're asking them to go to lots of different places for follow-up, there's a possibility they might not be able to get there, and things like that. The fourth part, which is the most difficult and complex part, is called Suggest Some Strategies for Prevention. And this carries most of the points. In fact, more than 50% of your score will come from this part. And this is what I'm going to explain in some more detail. But that will be in part 3.